Good evening. Welcome to Our Watch Wednesday Night Live. Glad to have you guys tuned in with us. This is the place where we talk about the truth that's going on, all the things around the world, the things in our nation, the things in our state, lots of stuff going on. And we want to be a source for truth for you guys, and lots of topics that we talk about here. Of course, parental rights is a big deal to me, and I know it is to you as well. And there's a lot of things going on in our culture right now that we want to know about. And so as we go through the stuff we want to go through tonight, I pray that you would choose to follow us on Instagram, subscribe to us on YouTube, like us on Facebook. We want you to hear the information and know that we are a source of continual truth for you as you seek to raise up your family in this culture that seems to be just spiraling down the toilet right now. There's so many things going on in this world. We have a special guest tonight. I'm going to introduce her in just a moment, but we're going to talk about some medical issues tonight. Of course, in the Bible tells us that those who are sick need to go see a physician. This is actually what Jesus told us. If you're sick, see a physician. And so there's so many different topics we're going to talk about tonight. Of course, male and female hormones are going to be one of those things that we need to talk about because we see a large push for the transgender ideology in our school systems, with our children, stuff like that. So we're going to want to talk about that. We're going to talk about the type of treatments that are given to people. And then also, we want to talk about something that's, I guess, obvious to everybody right now, the whole COVID-19, the stuff that's going on with that. And so in order to do that, we've actually got a very special guest with us tonight. Dr. Patricia Bogema is an internal medicine physician with additional training in functional medicine. Her primary care practice, she does traditional medicine, but integrates her training in functional medicine to help reverse chronic disease and decrease or eliminate medication use. She provides personalized care, wellness and nutritional counseling, and bioidentical hormone replacement for men and women to help achieve the patient's goals. Dr. Bogama, thank you so much for joining us tonight.
Well, thank you for having me.
Yeah, I'm so glad that you're here. You and I have had lots of discussions on several of these topics, so I was really excited when you agreed to come on the program tonight because I think the discussions you and I have are things that many of the parents and families that are tuning in, they're asking these same kind of questions that I've asked you. And before we actually get into these questions, let me ask you one so that way the folks at home understand, because maybe I'm not the smartest guy in the world, but when I hear the doctor of internal medicine, it sounds very impressive. And I know it is, but what is it? What is a doctor of internal medicine? What is it you do on a day-to-day?
Well, I'm a primary care physician, but it's really for 16 years old and above versus family practice, their birth to death. So I take care of diabetes, high blood pressure, high cholesterol, typical chronic conditions. If you're sick, you come in with whatever symptoms you have. If it's upper respiratory infection or whatever it is. And then if I do what I can as far as my treatment can go, and then if I need to, I will go out and send you to a specialist if needed. But I'm sort of the cruise director. I take an overview look at what's going on with you, try to keep you well. Mm-hmm. That's really what I try to do in my practice, is keep you well.
All right. So you keep people well. You're a mother. You're a grandmother. So I think there's something just intrinsically a part of a mother and a grandmother, and that is to want to keep people well. And you didn't start off at a young age being a doctor, so you kind of said, hey, I'm going to wait. So why don't you tell us, when did you become a doctor? How did that become the case for you?
Right. So what happened with me is I was a teenager in the 60s, and I read a book by Adele Davis, and it was on nutrition. And so I was sort of a hippie without the drugs. And then right out of high school, I started working for doctors. Now, when I graduated from high school, there wasn't a big push for women to go into healthcare or the sciences, but I loved nutrition and wellness, so I started working for a doctor. Well, I then later on got married, had children, and when I was 38, I decided to go to college, and I started at RCC Norco campus, started slowly, and I really wanted to go to try to be a doctor, but I'm an older student. There wasn't a lot of support to really help me to go in that direction. And because frankly, they said, you will never get into medical school. It's just not going to happen at your age. And you can look at demographics of medical schools and you can see the age of who they admit, and they typically weren't my age. So I was fortunate, the Lord just made a path for me, and I was so driven. It's like, when the Lord has you driven and passionate about something. So, I did get admitted into medical school, which I'm so grateful for that. And then I went and did my residency at Loma Linda. I was actually the 50-year-old intern. I guess there's a sitcom about that right now. So, I did do it later in life, but I came with that. I came a lot of experience with raising a family, with just experiencing life. And so it really helps me to relate to patients in that way.
That's great. So you're dealing with patients day to day, and one of the big topics for me, and I know for many of the people that are tuning in, is the hormones that are going on, the male and female hormones, how those are implemented, why they're implemented. And so why don't we just talk for a moment for the folks at home, maybe just like a recap, a refresher. So you have male hormones, female hormones. What do they do? How do they work? If you could kind of just bring us up to speed, so that way as we continue on in the discussion, we have a general idea of what we're talking about.
Well, actually, men and women have the same hormones. They just have them at different levels, and they do different functions, and at times they change structure. So when a baby's developing, if they're a male, they're an XY chromosome. If they're a female, they're an XX. So on that Y chromosome, if it's working well, then there's a process that takes place, and testosterone is produced, and it goes out and it changes the anatomy. So if there isn't a functioning Y chromosome, or if everything goes well, it becomes a male. If not, then it's a female. So we just have different levels of those hormones. As we go through our lifespan, those levels fluctuate and change. When a woman has children, her hormones change. Things get out of balance. Perimenopause, menopause. Men have andropause, and it's when testosterone levels begin to decline. And what I'm seeing in a lot of patients are hormone levels, especially in men. It's very interesting. I'm seeing the levels of males' hormones lower and lower, and I'm not, I think it's a lot related to stress, our food supply, what we're eating, if we're not sleeping. All of those things can diminish or cause those hormones to be out of balance. So when someone wants to get well, using hormones are part of that wellness. But you also can't think of them as this magic bullet that here I take this hormone and I'm going to feel better. You have to look at the whole picture.
Okay, so male, just that way we have some figures. So if a male has a certain level of testosterone, where's that supposed to be? And we're talking about an adult, grown, healthy male.
Right.
Where's those levels at?
So first of all, when we do hormone replacement, what we do in functional medicine is more of optimizing levels. So you can have a reference range or a normal range for a lab value. Lab values are typically determined by the population of patients that go to that lab in that region. There's many factors that bring it in, but there's some variations in labs. So you have a normal range, but if you have a range this big, you're not going to feel the same here as you do here. So down here, even though it's normal, you don't feel as good. So when we optimize those levels and get them keep it in the normal range, because we don't want to do harm, you want to optimize, make sure that the patient feels better without having any negative symptoms. So for instance, typically there's different labs. For a male, the upper limits of normal might be 1100. at, say, a large HMO that has a sort of an enclosed lab within their system, I've seen their range only go up to about 650. So there's a huge difference there. Now, is it the population of patients? Is it what they've chosen to make the normal values? That part I don't know. But when your levels start declining, you just don't feel as good. Fatigue, you start losing weight, decreased mental focus, irritable. So many times I might have a woman who comes in and is on hormone replacement, and her husband sees how well she's doing, and he wants to come in and get hormone replacement. And
Naturally.
Yeah. And so she's thinking, oh my gosh, this guy is so mean. Now you're going to give him testosterone. He's going to be, unbearable. But what happens is he's grouchy and mean because his levels are low and he doesn't feel good, and it just comes out that way. I'm not saying all men are like that. I'm just saying that, sometimes that happens, and just optimizing the levels can help them to feel better.
Okay.
So.
All right. So let me get some clarification on what you're saying as far as the lab. So somebody comes to you that says, hey, I'm feeling irritable, whatever, or maybe I'm not recuperating as well. What are the reasons? People come in and they have these reasons, and then you send them to get tested? And
Right. So a lot of symptoms that you can have for a hormone imbalance are non-specific, meaning I'm tired. Well, I'm tired could be anything from, you're not sleeping enough to you have something very serious. So many times the symptoms with hormone imbalance are not specific. I mean, yes, a woman who's having hot flashes and night sweats, that's pretty obvious. But a man can have difficulty, like you said, recovering from after working out. Just his endurance level overall might decline. So it's all part of the workup to see an overall look at your health in general. And actually, if a younger man, 40s, 30s, has low testosterone, I want to know why that is, because that's not normal. They should have higher levels. Yes, they begin to decline as you get older, but they shouldn't be that low. So why? I want to look for the root cause, and what can we do to make that better?
so they run out, you issue a lab, they go and get the lab work done. As they get this lab work done, are they put in with a specific category of people, or is it just generalized? Like, let's say 50 men go in, they all get lab work done. Are they all getting the lab work done for the same exact reason? My question is then, do we have one person who's getting lab work done and they may have cancer, or another person doesn't have cancer, they're getting lab work done, and they're both getting tested for their testosterone levels? Like, can you end up with skewed figures and just lumping them all in together?
So when you think about lab values, how they base it is on a population of people. Well, most of the people who go in and get lab work are typically not feeling well, so we're sometimes basing our lab values on sick people. I mean, that's not exactly true, because we do have some normal ranges, but when I see things being skewed, and I've seen things change over the years in values, so that's just interesting to me. I can't say what a lab's doing. I can just see when I get a report. I can have 3 different labs send me a report, and their values are all different.
Okay. So I've been saying something for a long time. I'm sure if you're watching this program, you probably think something similar to me. I think that there is a war on men here in our nation, and I think even around the world. And I think there's this push to make us less manly. I agree. I think, when I think of men back in the 50s and 60s, like the Marlboro man, just, he's got the cowboy hat, and he's just, he's just this tough, rugged man. And we're coming to a point now in our culture where they say that's toxic. It's toxic masculinity. We have to just push a man down, and he can't be so manly, and he has to get in touch with his feminine side. And if you're watching this, I've always said the same thing. I I'm not feminine. I'm masculine. I have a feminine side. Her name is Nikki. It's my wife. That is my feminine side. And if I didn't have her, I wouldn't have a feminine side.
Right.
I'm a man. This is how God's created me. And I don't apologize for that. Men should be able to love people and be very kind and gentle, but at the same time, get physical and rough if they have to protect their family and protect community and to work hard. And I think that's important. So as we look at the whole idea of treating a man for this type of deficiency, are you seeing that as you go out and the medical world's ever changing, are you seeing a push to not treat men for this? Are you seeing anything like that?
Well, actually, yes, and that's been going on for a long time. It is not a popular issue. So traditional primary care, they don't even address these things. Rarely do they even check the numbers. Usually men, sometimes women will ask for their hormone levels. And I agree with the demasculinization. I mean, I'm seeing it. I'm seeing in the labs values change over time. I don't know where that's coming from exactly, but I do see a change in the numbers. And men are feeling it and noticing it. They just don't feel as good. So when we try to give these hormones, there's always a pushback from other providers. I mean, not always, but a lot of providers will not. They think they're harmful, whereas we have studies that actually show they're beneficial. We know as testosterone goes down, heart disease goes up. As testosterone goes down, dementia goes up. When the VA did a huge study, I think something like 83,000 men, and they found that the men who had low testosterone and had the levels, they had replacement, they had a decreased risk of heart disease. So, there is proof to see that, but there is some pushback. For instance, I've been at conferences before where I'll go into one lecture, and it's on osteoporosis, specifically talking about women, but men can have it as well. And they'll go through all the things that protect bones, and the number one thing is estrogen. But then when they go over how we're supposed to treat, estrogen isn't anywhere on there. It's all pharmaceutical things. I mean, occasionally they'll throw in a calcium or a vitamin D or something like that. But I will raise my hand and ask the question, if estrogen's the number one protector of bones, why aren't you offering it? Well, no, we can't do that. And I'll ask why. We just don't promote hormones, but they can't answer why. And it's just either they're not trained, they have fear of them, those kind of things. So, but then I can go into the next lecture, which can be on transgender treatment, and show now we're taking patients where when we do bioidentical hormone replacement in men and women for their biological gender, I'm keeping their hormones within their range. But with transgender, and there's a pushback for that. So now with transgender treatment, we're treating them way outside of their biological range. If the biological range was harmful, why isn't the out of range harmful? I can't give a man, or I won't give a man, high doses of testosterone for performance enhancing. That can be a legal issue for me and can be harmful to the man as well. So, I ask this question at these conferences as well. Why, if it's bad over here, the lecture we just had, it was harmful, we don't recommend hormones, but over here it's not harmful. We have to really be honest about what's safe for the patient, no matter the social issue, because none of us want to do any harm. So we just have to be careful if we're treating to look for things that can cause harm.
Okay. So just so I'm clear, what I'm hearing you say is you walk into one lecture, they're telling you, okay, biological male, there's a certain range, don't go above this range
Right.
for the testosterone. If you go above this range for testosterone, it can be harmful to that male. Then you go into another lecture and you have a biological female, and they're saying, well, this biological female is transgender to a male, so you can raise the levels up, and these levels are higher, and they're telling, well, don't do it for the male because it's harmful for the male, but because it's a female, let's go ahead and do it.
Right. And so I think there's a lot of things that we don't have enough time to really evaluate, but there is a concern that no one's talking about the harmful effects, because I think a lot of it is that they're just afraid, or we can't speak up. We're look at Dr. Erickson, the two doctors in Bakersfield. They spoke up. They had data to support their COVID findings, gave some recommendations, and they've been, crucified.
Right.
And if doctors can't speak up, we're the advocates for our patients. If we can't speak up, that's not right. We got to be able to be whistleblowers too, right?
Right.
Because ultimately, we don't want to hurt a patient. So, but doctors can lose their jobs now or they can lose contracts with insurance companies, whatever it is. Our licensing boards can come after us if we don't sort of follow the path. So we need to think outside the box. If we are all thinking the same, no one's thinking outside of the box can bring about better things. And if we are constrained to do that because of fear, how will we find new developments that might really help patients in another way?
Right. I was raised up to understand the idea of going to school, especially university. You're getting into this higher level of education, and it should be a place where there's diversity of thought. It should be a place where people are allowed to question things and not just go with the status quo and not be told how to think and what to think, but let me use the brain that God's given me and let me question these things, because when you have that question, it does produce something that where if you weren't allowed to question it, you end up with a bunch of people thinking exactly the same way, and that's not going to benefit anybody. So I would assume that in medical school they were teaching you to question these things.
Not necessarily. There's sort of a standard of care we learn in medical school and in our residency, and you follow that standard of care. And if you deviate from that, that's where there can be repercussions. So, for instance, even now, as physicians, we're evaluated through insurance evaluations. Say you're a diabetic, or say you have high cholesterol. If we're not putting the patient on a certain medication, then we're not considered a good doctor. So, but if that patient doesn't want to take that medication, or I have some concerns about that, that maybe I don't agree that we need to be actually doing something, I have to decide, am I going to risk not following the standard of care because I'm going to be evaluated poorly for not doing it? Or do I have to do it? Do I want to do the best thing for my patient? I will always default at what's best for my patient. That I can't do it different.
Yeah, I would hope so. Yeah,
and most
I
doctors,
think that's what we all want from our doctors.
Right, but and right now doctors have the highest suicide rate because there's a lot of pressures on doctors. So we have the highest suicide rate of any profession. And I think it's because we're really not allowed to practice medicine right now. I think one of the things that I felt for me when the COVID thing first started, we were like all hands on deck. what do you need us to do? I mean, all of us were like, let's get to work here.
Yeah.
And it felt freeing, like we can practice medicine again. We can help again. Instead of checking the boxes on our EMR going, okay, did I ask that question and make sure that I fulfill the thing that's required by the insurance company to get my check mark? And so we need to get back there.
Yeah. That's something I've seen just over the last like 12 years. I've noticed that, like 10, 12 years, where going to the doctor, it's suddenly, instead of it being, hey, I have a doctor like really, really wanting to find out what's going on with me. I have a doctor that's really trying to check a bunch of things on the computer. What do you think? Was there something that caused that change?
Well, actually, the Affordable Care Act started all that, where we had to meet all these benchmarks, meaningful use, again, depending on if we fulfill the meaningful use or not is how we're reimbursed. So if we don't do things correctly or to the standards, we don't get paid as much from the insurance company. So it's, and if you're in a group situation or some kind of a corporate, you're a corporate physician in a group, you have to go by their guidelines, because it's all coming down from insurance companies and CMS, which is the head of Medicare. We have these guidelines we have to follow. And so it just comes down to the physician, and they're trying to fulfill all these things that are required by insurance companies. And at the same time, a patient comes in with a lot of symptoms, and we got to make a medical decision, come up with a plan, do an exam, do test, all of this in 10 minutes. It's not safe medicine. We need to take our time. We need to fully evaluate the patient. We need to have a minute or two to do an exam. I mean, it's really concerning.
Yeah.
And how medicine is going.
Yeah. One of the things that really concerns me is what you're talking about with the transgender treatments that are going on. And for the people that are watching online right now, let's talk a little bit about these treatments. What is actually being done for let's say a male who in his mind believes that he's a female, prepubescent. Let's talk about kids. Because I know that one of the things they're doing now, and they're really ramping this up while all the kids are at home, they're working on all these programs to get, like, around where we live, here in Southern California, Chalk Hospital, Children's Hospital of Orange County, Children's Hospital of Los Angeles. They're trying to put wellness centers on our public schools so that way the kids can go get transgender therapy at school without the parents' knowledge or consent. Now, that for me is very alarming, is very concerning. And the question then is, well, how does this get paid for? And of course, tax dollars is where this comes from. But what is it that they're going to be doing to our children while we're at work and we have no clue what's going on? What are the type of treatments they're doing?
Well, now I don't do pediatrics, so I can't really tell you what from experience, what treatment's going to be done, but they're either going to give them, if it's a female who wants to transition to male, then it's going to be a testosterone kind of thing. If it's going to be a male that wants to be female, I guess they're going to give them an estrogen. That's what I'm thinking. I don't do children, so I can't really answer that. My concern is for a child, it's the same way I felt about bariatric surgery or weight loss surgery for children. When that was passed that they could have surgery for weight loss, that changes their anatomy forever. To make that decision as a child, there's got to be a different way of doing things and give them a little bit more time till they're mature before you change anatomy forever.
Sure. Right.
And even with hormones, there's going to be permanent changes or likely permanent changes even if someone was going to stop a hormone. If a 14-year-old has acne and gets placed on birth control, that's a synthetic hormone. That can make some changes in their body forever with receptors and how things go. And it may take years, if not indefinitely, to actually reverse some of that. So again, we really need to think about, this is my opinion, I don't treat children, but my concern is when you change things at a young age, they may change their mind. They may, there's many things that could happen there. I think there needs to be a little bit more time to evaluate them.
Okay. Well, let's talk about post-pubescent then. Let's talk about adult males, adult females. They start getting this type of therapy. You know, it sounds to me like that's something that could harm them physically. I believe it's going to harm them emotionally and spiritually, but are there physical ramifications taking a female and raising these testosterone levels to that, you know, higher than what they would do for a male?
Well, right. So one of the things I was saying is that when we give, even if I give men who want to remain a biological male testosterone, even if I'm keeping it within the range, there's many things that I'm monitoring. Testosterone is blood doping. So what that means is it increases the number of your red blood cells. Red blood cells or your hemoglobin carry oxygen. That's why when you blood dope, you have improved endurance, and that's why it's not allowed in sports. So if you have too many red blood cells, that can be dangerous. So in the men that I treat with hormones, I'm always looking at that. And some men have a propensity to increase their red blood cells more than other men do. So they have to donate blood. So looking at liver enzymes, sometimes taking hormones can increase your liver enzymes. The body is not metabolizing them well for many reasons. It could be your genetics. It could be that you sort of have a toxic overload and you have to kind of clean up the liver a bit. It could be the type of hormone that you're using. There's many different things. So if it can be harmful in a biological range, I'm a little concerned that, and again, I'm not trained in transgender hormone replacement, but as long as we are making sure that we're monitoring the things like we would be and be as concerned. That's a little bit of my frustration is if we're so concerned about treating biological genders within their range, why aren't we outside of the range? It's do no harm.
Right. Yeah, it just doesn't seem to make sense, does it?
It doesn't.
Are you in a position right now where you may be forced to do this? I mean, I know some doctors are saying, "Hey, I've got this either a religious conviction or whatever the reason is that like I don't want to perform abortions, I don't want to perform transgender therapy." Are you in a position where you're going to start to be forced to do some of these things?
Well, this is one of the things that came up in last year in 2019. It was probably around April. So we've had a law in place. So when I went to medical school, during my rotations, if I was on a rotation where abortions were being performed, I had the option where I didn't have to perform an abortion or be in the operating room, and there were no repercussions. So we've had this law in place to protect us from anything against our beliefs, that we had a constitutional right to object to doing that. So, but what happened is there was this push to change those laws that would, abortion's not going to affect me, but what's going to affect me is physician-assisted suicide. So in physician-assisted suicide, right now, I don't have to participate in that. If I don't want to, and I'm a hospice doctor, I take care of end of life, I just don't participate in physician-assisted suicide. So I was protected from that as well. Well, there was a movement last year by the framer of Obamacare, who, with another professor, that were trying to change that law. So, and it was the slang name for it was "you choose, you lose." And what that was is if you choose health care, you lose your constitutional right to object to doing those things.
Wow.
Now, we always treat every patient the same. I'm not going to treat somebody different, if they want an abortion, didn't want an abortion, if they want physician. I mean, that doesn't matter to me. I would still care about the patient, and I would find a resource for them. But that doesn't mean that I have to perform it. Well, actually, like I said, I think it was April of last year, President Trump protected that. So we still have that constitutional right. But there are some, I know there was a case in New York where a gynecologist was still being, she was in trouble because she didn't want to participate in abortion. So I don't think they want Christians or those of us who have either ethical or moral reason in medicine, and you're going to lose a lot of providers. There's a lot of people that care, whatever their religious. It doesn't have to be a religious belief. It's just do no harm.
Right.
And those two ends of the spectrum are taking a life. And we don't go into medicine for that. We're here to help people get well and stay well. Or in the case of hospice, I want to make sure they're as comfortable as they can be and not suffer at the end of their life.
Right. Awesome. Well, I'm glad for right now you still have that constitutional freedom. So I hope that it stays that way for you. We see a lot of movement right now with the COVID-19. We see a lot of push for a lot of different things. There's a push right now for this term we're hearing, the new normal. And one of the things that I love, we had actually the sheriff of Riverside County today said any form of new normal strips us of our constitutional rights. We can't push to a new normal. We have to keep our rights, keep our freedoms, and we see that that with the COVID-19, a lot of the numbers aren't adding up. As a doctor of internal medicine, are you seeing that with the COVID-19, that what you were initially told, because you said earlier, we got excited, we get to practice medicine again, and there was a lot of numbers being thrown around. Are you seeing that the numbers aren't adding up?
So I think a lot of us went through, not just in healthcare, but all of us as Americans and around the world. Initially, we thought, this isn't going to be worse than the flu, because we know, around the world, there's millions of deaths a year from the flu, but we know that hundreds of thousands in the U.S. We know that every year, but we've never reacted like this. So we were going, well, it seemed like a lot of hype. I think what changed for me personally is when I saw what was going on in Italy. Then it was like, oh my gosh, and that's when everything started ramping up. So I think watching what was going on in Italy for me really made me concerned, because it's like, wow, this seems bad. So, I'm on staff at 3 hospitals. I, said, hey, if you need me, let me, I'm here to help, because I used to be a hospitalist, which is a hospital doctor. I did that for, many years, and then because it about killed me, I went into private practice instead. So, but I still have skills and I could still do that. And I also volunteered for the California Medical Corps, but they keep sending me emails that they don't need me. So, and I get the census reports from the hospitals, and, hospitals are about half full, ICUs are not full, vent beds are, at 20%. So I'm not saying every hospital every day is like that, but I have not seen a full hospital and all the vents used up yet. So, and I get the census regularly. So I'm going, we've definitely not only flattened the curve, we didn't even get near the curve. And that was our goal, to remain inside, is to flatten the curve. And we achieved that. But there's just some things not making sense. And I think a lot of we get different numbers. We're concerned about things that we're seeing. And I think not even in healthcare, just the public in general goes, something's not adding up.
So yeah, something's definitely not adding up. As I look at the numbers, I'm trying to make sense of why we're seeing the the different precautions they're telling us to take. I mean, we saw at the very beginning, don't use a mask. The masks aren't going to help. Now we're being told, no, use the mask. Now we're being told you can't even go anywhere outside unless you have the mask on. And we're told all these different types. So let's talk about the mask. I mean, is the mask helping us? Should we be using a mask?
Well, I think the masks are unsafe in many ways. First of all, I'm concerned about if people are driving their car with a mask on. Please don't do that. I'm afraid their CO2 is going to build up, they're going to get lightheaded, and they're going to get in an accident. So when I'm doing my physical distancing, it's when I see someone in a car with a mask, driving with the mask on. That's my physical distancing.
Yes.
And but I've actually had some patients recently who are coming in with symptoms, and when I ask them how often how much they're wearing a mask, and they tell me, I think a lot of their symptoms are coming from wearing the mask too much. There's certain lung diseases that the mask is going to make their lung condition worse. So, but even if you don't have a lung condition, your oxygen level goes down and your CO2 goes up, and we're breathing the CO2. We're not meant to do that. And it can make you feel lightheaded, dizzy, and people are getting panicky. I think there's almost a mask PTSD now.
Yeah.
So people are choosing not to go outside, not to go to the store because they're afraid to put a mask on because then they feel weird. And so they say they feel weird, I'm going to pass out. Well, it's because they're breathing their own CO2.
Right. Yeah.
So.
I've noticed, I just stopped wearing the mask. For me, it's I can't breathe. I feel lightheaded. I feel like I'm getting sick wearing it. So I've just chose, shoot, we live in America.
Right.
So I just chose, hey, listen, we live in America. I have freedom. I can do what I want.
Right. And I feel
and so I'll just make sure that I keep my distance. So let's talk about distancing. We want to keep the distance. The thing is, I don't want to make anybody sick. I don't want to get anyone sick. I don't want to harm anyone. I'm sure everybody watching online, you feel the same way. You don't want anyone to get sick or hurt anybody. But at some point, we have to really question these things. So for me personally, I just stopped wearing the mask, but I keep my distance. If somebody is, if I could tell that they want to keep that distance, is the distance thing a good idea? We're putting numbers on like at the supermarket, we got numbers and where we have to go, and is this helping?
Well, I guess technically a germ isn't going to fly over there. That's the whole idea, is they somehow were able to measure to see how far it would go. I think the number one thing you can do is wash your hands. Soap and water. Wash your hands. And I don't know, I don't think our immune system is suffering by being indoors. And the more we're indoors, everyone's talking about this surge when lockdown is over. Well, we're going to have a surge because we're on lockdown. If we weren't on lockdown, we probably wouldn't have that surge. They're looking at Sweden now for their models. South Dakota, they didn't have a lockdown. So there's some different areas that, we're going to look at when this is all over to see what worked and what didn't work. But we want to be exposed to some things in the environment to help our immune system. The other thing I'm concerned about is we're putting cleaning, I'll go to the grocery store and they're spraying the carts down, they're dripping with something. What are they putting on there? I mean, now we have all these chemicals, we're killing everything in the environment. Are we creating super bugs? Because now we're over sterilizing the world. That's not good either. So.
Because there is a certain level of bacteria and stuff that we're supposed to be exposed to, right?
And it's always been here, and people just didn't think about it. It's actually, we have bacteria inside of us. That's our gut biome. That's a good thing. We want our gut to be healthy with good bacteria. But when you sterilize the environment, it's going to eventually change our own health.
Yeah, so it sounds, just what I'm hearing from you, what you're telling us is that all the precautions we're being told to take right now really aren't the right things. Maybe the social distancing, and obviously washing our hands, but going indoors, covering ourselves with masks, and quarantining everyone that's healthy doesn't seem to be like we're taking the right approach medically. Every doctor I've talked to, including you, it seems like these approaches aren't really what's good for us, and we're probably, because we're taking these approach, we're probably going to see even more damage down the road.
Right. So did I talk about this already, about the surge and then the flu season?
You mentioned the surge, but you didn't elaborate. So
okay.
when you say the surge,
So after
bring
we
the flu season in.
Okay.
Tell me what you mean.
Okay, so after the lockdown and we're out more, we will probably see a rise in illnesses, and that's because we've been indoors. Our immune system is not working as well. So but then a lot of people are concerned, okay, so now we're going to have a surge, so then we think we should be locked down to get through the surge so that surge doesn't happen. Well, it's going to happen if you go outside. And then people are saying, well, what about, now they're saying in October we're going to have another second wave. Well, that's cold and flu season. That lasts from October to April. So are we not going to go outside until April? So it's really unfortunate. People are very scared, and they're getting to becoming agoraphobic and don't want to go outside. And that's my concern, is sometimes we just got to rip the Band-Aid off and go outside and try to build our immune system up. I mean, that's what I do in my practice, is I try to help you to be well so that you can fight illnesses. It's been interesting for me. If my patients ever wind up listening to this, there's 4 things I want my patients to take: a multiple vitamin, probiotics, vitamin D if they need it, and fish oil. The probiotic, that's keeps our gut healthy, and 70% of our immune system is in our gut. So we want to help fight disease by keeping our body resilient and able to fight. Vitamin D, they've gone back and looked at some studies from a few years ago on vitamin D and how the correlation with influenza. And not that it kills the virus, but it helps the host fight the disease. So now they've made, sort of extrapolated, like, make sure you're taking vitamin D to help protect you against potential viruses now. So I've had my patients say, because a lot of patients don't want to take things, but they're saying, I'm taking my 4, I'm taking them every day. And so now they're remembering all that yakking I did at them about trying to get their immune system. Because
you're a mom and a grandma, and you want them to feel well.
Yeah.
So what were the 4? So that way.
So multiple vitamin.
Yeah.
Probiotics. Vitamin D if you need it, and you need to check your levels, and you don't want to go out and just take a high dose of vitamin D because it's a fat-soluble vitamin. So fat-soluble vitamins can be toxic. So you want to check your level, okay? And then fish oil. Both fish oil and vitamin D are anti-inflammatory, so decreases that inflammation, okay? And helps the immune system as well. The other thing with fish oil, and you can do a combination of fish and plant, like flax, hemp, chia, that's plant omegas and fish omega, but our cell membranes are made up of a phospholipid layer, so there's 2 layers, and the lipid is your omegas, and when we're omega deficient, that cell membrane can get kind of crunchy. Think of it crunchy. And on our cell membrane, we have channels where things go out of the cell. We have receptors. And when that cell membrane's not healthy, those channels and receptors get distorted, so things can't go in and out of the cell. So just being on a fish oil can help with decreasing inflammation, keep your cells healthy, really good for the brain, and that's why you'll see in some dairy products, they'll put DHA, which is one of the components of fish oil, DHA, EPA. The DHA part of it is important for brain health. So to promote kids drinking milk, they want extra DHA for the brain.
Okay. And we also get our vitamin D, how else?
Well, you
Going
can,
outside?
People think it's from being outside, but to be perfectly honest, and what I've seen for lab values, I can have men that work in the sun every day and still have low vitamin D. So you can have a genetic mutation where your vitamin D receptor has a problem with it, so you have to actually take
Supplement that.
You have to supplement.
Got it. Okay, we are running out of time, and I want to ask you one final thing. We talk about the transgender thing. I think it's a burden on me to know that this is what's going on, especially as a Judeo-Christian value thinker, a biblical worldview. I hear that they're treating kids and adults. Of course, adults have the right, and this is a free country. I firmly believe people have the freedom to choose what they want. But as a child, it concerns me that they would even begin to implement this type of treatments on a child. That's very discouraging for me. I hear of all the precautions we're supposed to be taking, and I look at all the numbers, and I'm realizing something's going on. I think there's a globalist mindset with some of these leaders, and I think biblically we know that ultimately there will be a global leader known as the Antichrist, and so I think we're pushing towards that. This could be discouraging stuff, and so what would you say if you could just give one point of encouragement to everybody? What would that one thing be?
Well, first of all, do our best to stay well, really work. A lot of people are inside right now, and they're stress eating, it's their comfort foods, they're not exercising. Try to just every day do one more thing to get healthy. It's a good time to maybe look at, do you have a passion in your life? Was there something like me? I went to medical school as a grandmother. It's not that you have to, try to go to medical school, but if you want to, hey, now's the time to take one class. So, if there's something you're passionate about, look at that. What is it that you might want to do? Look at a college catalog. You can do them online now, and maybe start taking some classes, and learn about something new. So it's always about, and it's also going to help decrease stress, because when we're under all this stress and worried, that affects our immune system. We need to sleep. That helps our immune system. So that's more than one thing, but that's what I do.
I'm hearing passion there. I'm hearing if you got a passion, you want to find it and work on that and start to explore that. So that's a great, especially from somebody who says, look, I didn't start medical school till I was a grandmother. That's pretty inspiring. To me, it just tells me that and my mother, I made her a grandmother at 38 as well. And so, how cool is it that you at 38 went out and people told you there's no way it can happen, and yet here you are, and you're a doctor of internal medicine. Congratulations on that.
Thank you.
I think it's just wonderful. Every conversation I have with you, I walk away from it more intelligent, and so thank you for that. And I know everybody watching online probably feels the same way having heard this. So Dr. Patricia Bogema, thank you so much for coming on the show. We'd love to have you back. I hope you enjoyed your time with us. I'd love to have you back. Next week, we've got something special for you guys. We've got Bob Tyler, who's an attorney with Advocates for Faith and Freedom, and Netta Higuera, also an attorney with Advocates for Faith and Freedom. They are religious liberties attorneys, constitutional attorneys. They are fighting for your rights here in California and across the nation, and there are religious liberties being torn away from us. If you're a business owner, your right to open your business right now is being torn away from you. These are attorneys that are on the ground right now. They have filed lawsuits all across the state, and we're going to have them on talking about some of these lawsuits and some of the things that you can do to protect yourself legally. So you're going to want to find out more information on that next week. Join us on Wednesday Night Live here at Our Watch. Thanks for tuning in.